Okay, dear participants, dear speakers, it's my pleasure to open our webinar on the support on the Peace and Development Fund entitled Achieving SDGs and Ending Poverty Through Universal Social Protection. This project has been implemented now since 2 years and will conclude in June of this year. And it included various consultancies on the governance of social protection systems. We have, for example, one paper that will be presented on a global view of social protection systems. And then we have case studies on Argentina, Kenya, China, Mauritius, and Fiji. This project has been implemented jointly by UNDESA and the ILO in Geneva. And we work very closely with our counterparts of ILO in Cambodia and Pakistan. And I would like to express my gratitude for the really close and very fruitful cooperation with everybody involved in the 2 project countries and also in Geneva too. We'll start with the opening of our director, of our chief, Ms. Wenyan Yan. She is the chief of the Global Dialogue for Social Development branch at the Division for Inclusive Social Development at UNDESA. And I'm asking Amin to play her opening remarks in the form of a video.
Dear colleagues, due to COVID-19, we could not hold the in-person workshops and study tours envisioned 2 years ago. Nonetheless, it's an honor and a great pleasure to deliver opening remarks at this virtual workshop. This workshop is an integral part of the capacity development project supported by the United Nations Peace and Development Fund. It's jointly implemented by the United Nations Department of Economic and Social Affairs, UNDESA, and the International Labour Organization. As a department in the United Nations Secretariat, UNDESA provides policy analysis in support of decision-making by member states in the General Assembly and the Economic and Social Council system. We also support member states of the United Nations in building national capacity to implement internationally agreed development goals, such as the Sustainable Development Goals, better known as SDGs. In doing so, we build bridges between frontier research on socioeconomic development and policy discussions and decision-making in the UN, and between global development goals and targets and national actions for their achievement. You know, world leaders adopted the 2030 Agenda for Sustainable Development with 17 SDGs at the United Nations in 2015. The agenda is a blueprint for a future of peace and shared prosperity for people and protection of the planet. At the core of this agenda is the eradication of poverty and hunger, and a pledge to leave no one behind. Social protection has been proven an effective policy tool for the realization of many SDGs. Social protection reduces poverty and inequality. Social protection supports inclusive and sustainable growth with decent work. Social protection promotes access to health, education, and other basic services for all. Social protection facilitates structural transformation towards greener economy. As stakeholders at the forefront of your national actions for SDGs, you know very well the importance of social protection to sustainable development and social progress. The socioeconomic impact of the COVID-19 pandemic is reversing hard-won progress in SDGs. The number of people living on less than $1.90 a day is likely to increase by some 100 million for the first time since 1998. the number of food insecure people could almost double to 265 million in 2020, and working hours had declined by almost 9%. Moreover, the devastating socioeconomic impacts of the COVID-19 crisis are set to worsen pre-existing inequalities. As the most marginalized and disadvantaged in our societies, including older persons, persons with disabilities, indigenous peoples, youth, women, refugees, and migrants, are being affected the most. Governments have adopted relief and stimulus packages to counter the pandemic's impacts on people and society. Notably, social protection benefits are key components of these packages, even in low-income countries with very limited resources. For example, 51 of the 55 African Union member countries announced a total of 227 social protection measures between 1st February and 30 November 2020. The COVID pandemic further underscores a policy message we have been emphasizing, namely universal access to social protection is vital to shield all individuals and groups, especially those that are disadvantaged, vulnerable, or marginalized from the adverse impacts of shocks and structural changes. We enhance their capabilities, resilience, and inclusion. In fact, the Addis Ababa Action Agenda has identified delivering social protection and essential public services for all as one of the cross-cutting areas that will build synergies to help achieve the 2030 Agenda. However, despite the demonstrated value of social protection to poverty eradication and sustainable development for all, globally, 55% of people has no social protection at all. The 2018 edition of UNDESA's flagship publication, the report on the world's social situation entitled Promoting Inclusion Through Social Protection, actually highlights the gaps in access and insufficient benefits that undermine the effectiveness of the social protection to promote inclusion, resilience, and leaving no one behind. COVID-19 is a sad reminder that we must change the unacceptable status quo. UNDESA and the ILO have been working together to make this change happen. It goes without saying that global goals and targets are met through national actions. This project aims to support national sustainable development strategies. Today's presentations of research papers on global lessons regarding social protection governance, as well as national case studies, will provide the opportunity to learn from good practice in support of your national actions. We hope you will benefit from experiences of other countries to strengthen social protection systems in your national context and help your countries achieve SDGs. UNDESA is your partner in this endeavor. Before concluding, I wish to express our appreciation for the generous contribution of China to the UN Peace and Development Fund that made this project possible. I wish you great success and hope to meet you in person in the near future. Thank you.
Okay. So after the opening remarks from our Chief Wenyan Yan on behalf of UNDESA, it is now my pleasure to invite Valerie Schmidt to deliver her opening remarks on behalf of the ILO. Valerie Schmidt is the Deputy Director of the Social Protection Department at the ILO in Geneva. Please, Valerie, the floor is yours. You have to mute yourself.
Thank you. Dear colleagues from Pakistan, Cambodia, China, from UNDESA, workers and employers organizations, civil society organizations, and researchers. Thanks a lot for inviting the ILO to this webinar on the governance of social protection. I would like also to thank all the partners of this project, which is on achieving SDGs and ending poverty through universal social protection, for having this project and for organizing this series of exchange and discussions. This project, as Wenyan has recalled, is financed by the UN China Development Fund, and it's one of the only social protection projects under this fund. So China is not only supporting financially this project, it's also a core contributor in terms of knowledge and experience sharing. As you know, China has achieved within a few years universal coverage of healthcare and pension, old age pension, and has also a lot of experience in administering social protection, in delivering social protection benefits in all parts and decentralized areas of China, in linking central to provincial levels, in implementing management information systems, using inspection systems to increase compliance. So it is clear that Chinese experience is extremely relevant for the project, which aims at really improving governance of social security in different countries of the South, in particular in Pakistan and Cambodia. So this project, as mentioned by Wenyan already, is carried out in tandem by ILO and UNDESA. And so it's an excellent collaboration where both organizations have really their added value, and we are, thanks to the project, creating more synergies both at the global level and at country level. The idea of the project is really to help two countries, Cambodia and Pakistan, in improving the coordination of their social protection systems. As you know, as in many countries, social protection systems are composed of a constellation of programs, systems, schemes, covering different branches of social security, different groups of the population. So it's very important to coordinate the policies, also the implementation, to achieve greater results. Another area of focus of the project is really to improve data management information systems, to ensure that there is an increased transparency, accountability of the social protection systems through digitalization. And a final focus is really to try to improve compliance with social security law. In many countries, social security laws are in place, but still a large share of the population is not, doesn't have access because of a lack of compliance. Some workers are not registered, some enterprises are not registered. There is difficulties in paying regular contributions, so it's very important that compliance is improved in both countries. So the project is also working on that. But I will not go too much in details on the project's activities at country level, but what is very important is to note that the project has really a two-pronged strategy with focus countries, Pakistan and Cambodia, and a global component, which aims at supporting the country implementation by developing knowledge, practical knowledge, but also research to really advance the level of knowledge of the two countries, but also many more countries in the area of social protection compliance and management. And this global component also has a very important South-South learning aspect. And this is why an event like the event of today is so important, because we have around the virtual table practitioners from different countries that are here really to learn from each other and to really exchange not only their successes, but also their challenges, so that we can all progress and learn something today. Maybe a word on where we are at in Pakistan and in Cambodia. What is interesting in Pakistan is that we are working both at the national level and at the decentralized level. As you know, social protection was devolved. It means that provinces have a clear responsibility in the implementation of social protection. So at the national level, there is a lot of work in the context of a new supportive environment, actually, which is provided by the Prime Minister's Poverty Reduction Program, EHAS. There is a lot of work on advocacy for universal social protection, on improvement of compliance. And this work is done through specific national tripartite bodies that are really conducting strong advocacy campaigns throughout Pakistan. There is also a lot of work on capacity building. A number of experts from Pakistan were trained through our Turin Center on social protection, governance, information systems, and compliance. There is also a lot of stakeholders that have been trained through regional trainings that are organized in the different provinces of Pakistan. Also, an important component in terms of digitalization and reporting on the progress made in terms of social protection extension is that the project is supporting a sort of dashboard or data interface that helps the different social protection systems to really contribute to the collection of information that will allow Pakistan to report on SDGs on social protection, especially SDG 1.3, which is about building social protection systems, including floors. At the provincial level in Pakistan, there is a lot of work in Punjab. So the government of Punjab has realized that domestic workers in particular are really excluded from social protection. And there is a clear demand from this government, provincial government, to really design and implement a social protection program for domestic workers, which is now at its final stage of finalization, and the government has really a strong political will to make this program a success and has already put aside a sort of startup fund to start the program. In Cambodia, similarly, the project is really supporting the government, both in terms of the coordination of all the different social protection programs that exist in the country, and more specifically the National Social Security Fund, which is in charge of contributory social protection, both in terms of employment injury, health, maternity, and progressively will extend the benefit package to pensions, old age pensions. So helping the National Social Security Fund in improving its management information system, in building capacities in the ground, and also improving compliance with social security law. So I think these two projects at country level are an excellent basis for our discussions of today, and that will also go beyond, of course, the national situations of Cambodia and Pakistan. To really increase cross-fertilization, we had planned as part of the project field visits to Pakistan, to Cambodia, and also to China, and also the organization of a big conference in China. Unfortunately, given the situation of the pandemic, this will not be possible. So this is why we are organizing in tandem with UNDESA a number of practical workshops, really to ensure that this exchange of knowledge still takes place. And last point, we will have in June 2021 a 3 days online concluding event of the project, which will have a high-level day, which will provide all the findings and at a very high-level representation of the 3 countries of UNDESA and ILO. And we will have 2 additional days that will be much more practical to really exchange the lessons learned, the practical lessons learned from this project, so that we can continue in the future, we hope, to support both countries and maybe other countries in improving the governance of their social protection systems. So I will stop here, and I really look forward to our discussions of today. I plan to participate in all the workshop because I think it's very important that to learn from you, from your exchanges, and also to contribute to them if possible. Thank you so much for your attention.
Thank you, Valerie. And now we start with the presentations, and I would invite our first two speakers, that is Stephen Kidd and Shay Mcclanahan. They are with Development Pathways. Stephen Kidd is the Principal Social Policy Specialist, and Shay is the Senior Social Policy Specialist. And they will be providing us with an overview, talk about the global findings, and after that, we're going to go into the country studies. So Stephen and Shay, the floor is yours.
Okay, thanks very much, Robert. I'd like to start by welcoming everybody from Cambodia, Pakistan, and China to this webinar. I hope it'll be really, really useful. I think we've really enjoyed taking forward this research. We're very grateful to UNDESA and the ILO for enabling us to do this research, where we've looked globally at governance of social protection systems. So Shay and I are going to share this presentation. I should say that we've had a great team working on this. They'll all give the presentation, led by Shay, but also Alex and Serena, working on this study, and you'll hear from each of them of the work that they've done, and hopefully it'll be really useful to you as you think through governance and coordination of social protection systems. So go to the next slide. So I just want to start by giving a global overview of the project and the rationale. I think so. What we're doing is looking at governance, but I think one of the key messages from the report, if you when you get to read it, is that we're interested in governance for a purpose, right? It's not about governance for governance's sake. There's a clear purpose to governance. We want to set up good governance systems because we want to deliver universal social protection. We want to address the fact that, as we heard, 55% of people have no access to social protection globally, and of course in many countries the proportion is much higher than that. That's why we need good governance put in place. That's the purpose for doing it. And I think another key message that we've looked at throughout the report is that we need to look at a broader system of governance. Often we just look at one particular program rather than the whole social protection system. So what we've tried to do in this is look at a system-wide process, so that and not just focus on one particular scheme, because you could have one scheme that's well functioning, but the broader system may not be functioning well in terms of its governance. I think another strong rationale for looking at this is that we know that social protection systems are becoming increasingly complex. In many countries, that's fine, because where they have the administrative capacity to deal with increasingly complex systems. But across the global south, what we're looking at is more than complexity, fragmentation, high levels of fragmentation in many countries around social protection, which is making governance much more complex. And finally, I think the issues key messages that I think we want to get across in the report is that governance has to be seen as very multi-dimensional, and four key dimensions are one, the sort of democratic component. It's about governance is about participation of citizens, and citizens organizations within governance. It's also a very technical element. It's about the management and good administration of programs. We need to look at that as well. We also need to remember it's very political. We have very clear sort of executive and legislative powers. We have the executive branches, the government very involved, and parliament's very involved delivering on legislation. So we need to look at that. And it's also very legal. Moving on from the legislative elements, is very legal. It's about putting in place enforceable guarantees for citizens. It's no longer handouts. Social protection should be seen as handouts. It's about legal guarantees. It's about your rights as a citizen and what legally you're able to get. And governance systems should be able to deliver your rights for that. So next slide, Shay. So what we developed, the team developed in this study was trying to put together a framework within which we could try to understand governance systems globally. And of course, it's any framework, it's very simple, and the real world's more complex than the framework, but a framework helps us think through things and understand it much better. So throughout the paper, what we've looked at, and we'll go through in this presentation, is we tried to look at governance through 3 different levels. One is at the very high level, where we're looking at very, very much of the top levels of government and oversight of social protection schemes, where we're looking at things like national strategies, legislation, high-level institutional structures. Then we also look at the mid-level elements of social protection governance systems. Often that's to do with things like how management information systems make the broader system work, and how we can integrate together management information systems as well to make them work more effectively to deliver good information and good knowledge to those at higher levels. And then third level is what we've called the street level, where we're talking about the real engagement of schemes with citizens, how they engage with applicants to schemes, with recipients of schemes, and in terms of contribution collections, about registration, payment systems. However, let's not think that this is all happening in the street. Increasingly, what we're calling street level can be happening online as well. Okay, and I think the more we can move to efficient online systems, the better the governance will be. But of course, in many countries that isn't possible, and we always have to remember that even in high-income countries, in my own country, the UK, a move to online systems is leaving many people behind because they can't access, particularly older people and people with disabilities and others with lower levels of education, often can't access online. So we need to be thinking about multiple systems at the local level. Across all of these 3 areas, what we tried to integrate throughout the report is looking at what sort of principles of good governance that we need to be looking at each of these different levels, which around coherence and coordination of the system. So we're looking at a very system functioning well together. That we're looking at financial sustainability of the social protection system. We don't want to be putting in place systems that will fall apart in the future because they have lack of finance, which is a very political issue. It means about putting in place popular programs that have the support of citizens and all citizens. That's what makes programs financially sustainable. We want to look at issues of accountability of the government and program delivery to citizens at different levels in the system, both national level and also on the ground. Governance systems need to be transparent. We need to have transparency, a very sort of rights framework of information to citizens, whilst also protecting privacy and the right to privacy of information. So to get that balance right, it's about predictability and equal treatment. That's very, very important so that we don't have biases within the system. And it's also about participation of all sectors of society within this and adaptability of the system so that it can adapt to different realities. Next one. So very, very quickly, I'll just go through some of the high level findings and messages on the program, if we can get into the next slide. I think the first thing I think that the report tries to say is that, have good governance. We really got to have a very good understanding of what we mean by social protection. Social protection, problematically and globally, is a highly contested term. Everybody has very different understandings of social protection. And what we say in the report, it means within every country, there has to be a lot of work done to actually have within that country a nationally agreed definition of social protection and a very clear purpose for why we have a social protection system. Now, as most social protection systems mature, they tend to move towards emphasizing core life cycle benefits, about trying to address the challenges that we face across the life cycle. And of course, if we go back to the Universal Declaration of Human Rights of 1948, in Convention 102 and then subsequently Resolution 202 of the ILO, we can see the focus on these life cycle benefits that we have to put in place to protect us all as citizens across the life cycle. And if we do this, we will achieve our objectives of providing everybody with income security and protection across their lives. But this purpose is often contested. I think what we find in many strategies where they go wrong is that there's too heavily focused just on the one issue of poverty, and forgetting the much broader issues as well that need to be addressed about the challenges that we're facing across the life cycle. And what we see globally with social protection strategies that just focus on poverty, we end up with problematic programs that just focus on the poor, often very household transfers. We see that in many low and middle income countries, which are not particularly effective in addressing and supporting us across the life cycle and don't tend to have very much support and then to be very poorly funded. Whereas systems that build these life cycle systems tend to end up being much bigger and much more effective. So next slide, Shay. So another key message is the real importance of having a strong legislative and regulatory framework to deliver on good governance. That's absolutely critical important. It's a minimum requirement. I think within contributory programs, social insurance programs, it's natural to have strong legislation behind them. We find a much stronger statutory basis behind them because they require consensus from different social partners. They need to clearly set out the rights and obligations of contributors and beneficiaries of social insurance programs. Amongst tax financed, or what we often call non-contributory benefits, we don't find necessarily the same level of backing of legislation, which can lead to real weaknesses within those programs. However, doing a study around the different types of tax finance scheme globally in low and middle income countries, we do find that as you move to more life cycle benefits, such as old age and disability benefits, we find many more grounded in legislation because they have much stronger national commitments, whereas the sort of social assistance programs for poor households, often the conditional cash transfers or unconditional cash transfers that we find often have very weak legislative basis or no legislation, or it's just enabling legislation that says, oh, we will do a transfer, but really doesn't set that out and doesn't protect that program. And sometimes these programs can shrink and disappear. I think we need to learn the lessons from Mexico of the well-known Oportunidades of Prospera program that had no real strong basis in legislation and disappeared in 2019, despite being well-known globally. So this is really, really important. Next slide, Shay. I think the other key area is that we have to have strong horizontal coordination of social protection within our nationally agreed definition of social protection. The key thing, though, within that, the horizontal coordination is to be clear, is to be very, very certain of which part of government is responsible for this coordination across the broader social protection system. And that central body needs to be strong. It needs to have a mandate that it can actually enforce coordination across the system. If it's too weak, then it's not going to work. I think in the paper we show the story of Bangladesh, where there's been a lot of support to put in place a coordination mechanism with many ministries involved, but it was weak. It didn't really have the strong political buy-in, and in fact, while the coordination mechanism been working well, it was a weak mechanism, and investment in social protection has gone down in Bangladesh because of the weaknesses behind that. So we need this, but it also needs to focus very much on the social protection system itself, how we understand that as the first priority, while also trying to build linkages with other public services, as you can see in this diagram. That's also important because we're achieving agreed outcomes, but many of these other areas are not social protection, but we need social protection sector and system needs to work with them to be effective in achieving outcomes, for example, on child well-being or older persons well-being, etc. Next slide, Shay. We also need to look at vertical coordination. Is very, very important. How central government works with different areas of local and regional government. And I think a key message here is that it really needs to be aligned to the governance system within the country. right? Every country has a very different governance system. Some have deconcentrated systems where it's really everything's run by central government. Some are decentralized. Some have federal government structures. And so the social protection system needs to be adapted to that. But you also need to very clearly set out the responsibilities of different levels of government. When that's unclear, then you're not going to get very good coordination around that. And one of the real challenges that we find globally is that governance systems are put in place, linking lower levels of government to higher levels, whatever the nature. Social protection systems often come later and often aren't adjusted to the actual governance system of the country. They're imposed in a different way and don't really function particularly well. But this also may require governments to actually rethink their governance system, broader governance system, to adapt it to the requirements of an effective social protection system. So next one, Shay. I think it's also, we need to think then very clearly through the institutional design of our system. We have here 3 diagrams of 2 high income countries with their institutional mandates and institutions that are involved in delivering the social protection system in the Netherlands and Norway. And then we have another country that's building its system, Ethiopia. And the interesting thing is, you can't see it very much here, but you'll see it in the report, is that Ethiopia has a much, much more complex system. Actually, there's many, many ministries that are delivering social protection. I mean, Bangladesh mentioned as another problem, with 35 ministries claiming to be delivering social protection. It's very, very dispersed. Often this has been driven by the interest of development partners that have worked with different government ministries to develop a very complex system. Whereas in Norway and the Netherlands, what you find is very clear leadership around one institution or one ministry within government, a much simpler system, developing much more complex or delivering a much more complex set of programs. And ironically, what we often find is that the low and middle income countries with much weaker administrative and much weaker areas of capacity have the more complex systems. So it's really important to try and streamline and bring this and make a more coherent and simple system for delivery, and that's how we're going to get much better governance. So this is a key area for countries to work on as they're developing it. And I think look at high income countries and how they've moved forward, and they provide very, very good models on how to build the system. Next, Shay. And I think finally, if I hand over to Shay, I think it's the other area is the sort of policy design elements. I think we really have to think through critically around the policy design. And this often goes back to this debate about whether we're going to have inclusive life cycle systems to protect everybody over the life cycle, or are we going to have what is very much poor relief for the very, very poor, which, I often make the point that this is very much the 19th century model that we had in Europe, but has been replicated in many low and middle income countries. If you can see in the bottom diagram, this poor relief model, where we have it's a bifurcated model with social insurance for those in the formal economy and poor relief or social assistance programs for those who are the very poorest, but a large group of the missing middle that don't receive anything, even though they're on low incomes and highly volatile incomes, highly insecure. Whereas we need to be moving much more to a social security model where everybody can access social protection, irrespective of where they are on the income distribution, supplemented by a little bit of poor relief. And these critically need to be multi-tiered systems. At the top, we have sort of examples of different types of pension system, which can be multi-tiered. And this is really, really important to remember, that we need to bring the tax finance system and the contributory or social insurance system together as one system and not think about them separately. As I just hand over to Shay, I'll just make one final point. I think what we've seen globally, as in low and middle income countries, is that while we've already had in many countries relatively strong, although they may be inefficient to a degree, contributory social insurance funds or schemes that are in place in many, many countries, the tax finance schemes that have been put in place, often with the promotion of donors, have been done completely separate to that and have often developed very different delivery structures. actually we need to think about bringing them together, and often taking advantage of existing strong social insurance funds to perhaps start delivering our tax finance benefits as well, and build on the natural advantage that we actually have in many countries to deliver a much stronger multi-tiered, coherent and well-coordinated system. So I'll hand over to Shay here, and she can continue with looking at the other levels of the system.
Sorry, I was searching for my unmute, which migrated to the top. Thanks, Stephen. So if we were concerned at the high level with things like national strategies, definitions, legislation, regulatory framework, I think now, moving to the mid-level, we become much more concerned about scheme management and delivery. So how do we actually realize these rights in practice? And of course, integration. So returning to the framework, the next slides, we're going to focus on management information systems as a core component of this mid-level operational sort of back office functioning of social protection schemes and systems. And increasingly in a digital age, these are the building blocks and the backbone to a well-functioning social protection system. So we're going to look at program level MISs, so specific to individual schemes and programs. Then we'll also look a bit at integrated MIS systems and options. So thinking a bit more carefully about what choices governments have in integrating their MIS systems in social protection, and what the implications of some of those choices are for achieving universal social protection, really in this, with keeping this long-term goal in mind. And then finally, we'll refer to some emerging international frameworks in sort of ICT management and MIS that countries can refer to, and that go into much greater detail than we'll be able to do today. So, as I said, a good program level MIS will support social protection delivery in various ways. So it can enhance accuracy and integrity of data through these data protocols, quality controls, verification. It can also improve efficiency and effectiveness of the program operations. And I think what's key is that it can enhance accountability and citizen empowerment. So this is one of the key messages of the report, is really how we link these citizens to the systems themselves, and the MIS system is one of the key ways. So you can see that MIS can support the systems all the way across the delivery process and the operations process of delivering a social protection scheme, through the communication strategy, the point of registration of beneficiaries, enrollment onto the program, opening accounts, onboarding. We've got cash out, withdrawals, so we talk a bit about payments, change management. So if there are changes to eligibility conditions, MIS systems can support that and can allow you to adapt more quickly. And also they can be the channel for collecting information on grievance and redress, and helping to channel that information both ways, upwards and downwards. So I think one of the key findings from the review that's really relevant across all of the levels, but becomes particularly important with MIS, is that, as Stephen mentioned, the overall capacity of the supporting environment really does matter for the kinds of systems that are likely to be effective in different countries. And so as a general rule, the review suggested that it's better to keep it simple. So wherever possible, as a rule of thumb, simplicity almost becomes a principle of good governance in low capacity environments. And that, when we're talking about low capacity, we're talking about, it could be an institution, so specific to a particular line ministry, or it could be the broader context, so the ICT infrastructure, or maybe the brainware, which these are concepts that are introduced in the review, might not really be present to support a really complex system. We found it helpful to analytically distinguish here between contributory and non-contributory schemes. So I think it's important to point out that contributory schemes have inherently complex MIS requirements, and that's the nature of the schemes themselves. So they have to keep track of contribution collection and compliance. They've got to administer complex benefit formulas based on really complex and constantly moving earnings records and accrual rates, and constantly changing circumstances of insured workers, which is only becoming more of a problem in the new world of work. And these really call for specific governance and MIS frameworks that are really robust and have the capacity to capture those things in real time. And this, I guess, luckily, for better or for worse, I would say, social security agencies in low and middle income countries included tend to have higher administrative capacity than some of the line ministries that are tasked with, paradoxically, administering some of the more complex schemes that are becoming more and more popular as social protection landscapes become more complex. So with non-contributory schemes, we do draw this distinction between those schemes that are administratively simpler, so have simpler information requirements for an information management system. And those tend to be the core life cycle schemes that have relatively stable information requirements, such as age, such as disability status gets a little bit more complex, but certainly for child benefits, keeping track of children's ages and old age pensions, that's a much simpler way of manage, or a bit of information to manage. And we compare those with schemes that are more complex, that tend to be popular flagship programs in a lot of countries that base eligibility on complex proxy means tests or conditions, apply conditions or sanctions. Again, those are moving time bits of information that have to be constantly tracked. So we do know a paradox here, that often it is those relatively weaker line ministries that are tasked with implementing the more complex schemes that have the higher information requirements that are linked to targeting and compliance. So I guess one of the key messages that whenever possible, simpler scheme designs are preferable. And we offer several case studies later on that will illustrate these points in more practical terms. So turning to the idea of integrated MIS systems, here again, we introduce some of these same distinctions, but I think wherever possible, the program level functions ought to be carried out in an integrated way. So as we become more and more digitized, social protection systems increasingly rely on really robust MIS systems to support this coordination and goals of interoperability that all social protection systems have in the long run. And in the report, we present a basic framework for thinking about integrated management information systems and social protection. This is based on Shashir and Barca. We hope that our colleague Richard will join us for questions to be able to clarify some of these in more detail. But just briefly, if you think about the different levels of MIS in a social protection system, you have a first pillar that focuses on the program level MISs that are specific to each program, which we've already discussed. And then when we start talking about integration, we go to pillar 2 and to pillar 3. Pillar 2 would be integration sort of across and within the social protection system. So across different multiple programs within the sector itself. So we think about integrated or single registries here that can emphasize common payment platforms, grievance appeals mechanisms, beneficiary management platform to know who's receiving what, et cetera. And then we can also think about pillar 3, which is really integration of that social protection sector with the broader registries and national databases that exist in the broader national context. So the tax systems, the national ID systems, civil registries, disability registries are really important when you're determining eligibility for disability benefits. So they need to be linked up with the social protection system. So that thinking about coordination, you have to think about within each of these pillars, but also how these pillars are coordinated across each other. And so I think one of the key messages is that governments really have to think strategically about how the social protection system is nested within this broader information ecosystem is the way we refer to it, to ensure that the management of individual programs and schemes does correspond to this broader planning and development for the whole sector. And that's where we really want to continue to bring the readers back in the report to this long-term goal, to think about what is, if your goal is to achieve universal social protection, what level of integration are you seeking, and how does the types of tools that you're thinking about putting in place, how do they further that goal? And what are the obstacles that they might themselves throw up in the process? So continuing on with integrated MISs, in the review, we are careful to distinguish between social registries and single registries, because I think there is a lot of confusion out there about what the different purpose of these different tools are within a social protection system. I think probably the headline conclusion is that social registries offer a limited potential for coordination across a certain type of program. And particularly, we're talking about these means-tested programs where it is true that in lots of countries they have traditionally have had very, very different eligibility requirements, different types of means tests being applied. And so if countries do want to consolidate or harmonize that, that's potentially a valid tool. Whereas single registries hold much more promise for system-wide integration across core life cycle benefits. And I think it's important to think more about what social registries actually do. And social registries, they've been widely promoted. A lot of countries and donors have placed a lot of hope in these systems, invested a lot of money in these systems to solve some of the coordination problems and fragmentation. They're designed to centralize and coordinate the eligibility determination based on means, so only means tested programs across these multiple programs that are targeted at poor and vulnerable families. So they essentially allow you a single point, a single type of registration and eligibility applied across multiple programs. On the other hand, single registries are actually coordinating information on who receives what within the social protection system. So they can support coordination, monitoring, planning in the sector. So they really do act as a data warehouse that can keep information across life cycle benefits and these household targeted, poverty targeted social assistance programs. So they have really as their primary objective to provide reliable evidence-based information for decision makers in planning how the sector will move forward. So continuing on with integration, I just am going to go over these very quickly. I realize that we're running out of time already, but we do highlight that greater integration in MIS is a really powerful tool, but it is not without its own risks. So introducing integration in MIS in social protection systems, you also have to then introduce separate governance frameworks to mitigate against these risks that it brings up as well. So you've got risks with the underlying data infrastructure and the data quality of the different programs that will need to be taken into account. The quality of the MIS system is really only as good as the data that's supporting it and the ICT infrastructure behind it. You've got to make sure that you have the actual human and financial resources in place to be able to support the kinds of systems that you're choosing. Also, I think it's important to note that even though, yes, you want more integration across, say, contributory and non-contributory systems, you do have to take a whole government high-level approach to this and ensure participation by all stakeholders, because there can be issues around data sharing, silos in information governance that can prevent some of that further integration in the sector that happens at the higher level. You've got rights to privacy, so there's a whole subfield dedicated, legal field dedicated to protecting privacy and putting in place governance systems in information and dealing with automation. The other issue with automation is that if you have in an integrated, say, social registry, if you have exclusion in one program, that is going to be replicated and systematized across eligibility for all of the other programs. So that's a very, very serious risk. And again, if you keep in mind that the long-term goal is to achieve universal social protection, then are you actually achieving it if you're using social registries or are social registries just an administrative solution to certain very, very specific and limited problems? So the other thing we ended up with is it's suggesting several of the international frameworks that have started to emerge. There are guidelines from the ISA on information and communication technology in social security. There's also UN e-government frameworks that countries can look to find more detailed information on this. So turning to the frontline processes, again, this street level interaction, I think as Valerie noted, the project was focused on compliance. I think this is often narrowly interpreted to be compliance with workers, compliance by workers and employers with their obligations to pay contributions. But in the framework, we really pushed to broaden this concept to also consider the state's obligation to comply with its own duty to provide at least basic social protection, basic income and health security. So recognizing again that this accountability is a two-way relationship and it's founded on trust. So at the front line, we're talking about contribution collection mechanisms, horizontal coordination, payment mechanisms. We'll look a bit at grievance and appeals mechanisms, and then some avenues for stakeholder participation. So in facilitating contribution collection and compliance, I don't want to say too much because again, there are lots of detailed guidelines, including guidelines developed by the ISA on contribution collection compliance specifically. But just to point out that where we have high rates of non-compliance, that is an indicator of low trust in the system and usually indicates an overall weak social contract behind that. So one of the things we point to is that, of course, enforcement is important. So it goes without saying that enforcing all of the rules that are already on the books is something that all countries have to work to achieve. And there's lots of work, including within the framework of this project, going into great detail on how you can improve enforcement. But one of the things that the review pointed out was that we also need to think about facilitation. So think about a more proactive role. So shift from a reactive role by Social Security institutions and labor inspectorates to a more proactive role that actually reaches out and facilitates the process of payment of contribution collection and compliance. So we highlight a number of cases where this is already happening in high income countries, but also in a lot of middle income countries. They're making lots of great gains in this area. We point to the experience of the mono tax in Argentina and Uruguay, which my colleague will get into later. And we also note the ICT-based solutions where you have single window services that are provided, again, as Stephen was saying, where this interaction with the state actually does happen online. We spend a bit of time in the review looking at horizontal coordination at the operational level. So Stephen mentioned it's very important to coordinate the sector up at the high level and make sure that you have one body that's empowered to coordinate at the highest level across these different programs. But that coordination also extends to the operational level. So it is really important to look at the dimensions and mechanisms such as single window services where citizens can be referred to all relevant and appropriate benefits in the sector through one single point of contact with the state. So these do play a key role and we'll spend a bit more time on them in our case studies. We also point out that especially in responding to shocks, you might need some specific frameworks for governing cross-sectoral coordination at the operational level. We've seen that with COVID-19, and we discuss in the paper some of the implications of that in the context of shock-responsive social protection. I'm going to go very quickly through the payments because I know we're going to talk a bit more about them in the case of Kenya. But just three quick points to highlight about payment systems is number one, that they can be a really important way of improving and enhancing financial inclusion among vulnerable groups. However, they require specific formal legal and regulatory frameworks to be carried out effectively, to be implemented and administered effectively. Now, these usually exist, again, a common theme throughout the review, in contributory programs, but they're often lacking precisely where they're needed most in these non-contributory benefit payment systems, which really are underdeveloped in low and middle income countries. And this has a lot of implications for governance, for rights, for accountability. So how you decide to implement your payments, whether it's manual or electronic, then has implications for how well you're able to achieve those rights in practice. And that also is context dependent. So electronic payments can really increase efficiency of systems. They can decrease leakage and ghost beneficiaries, but especially in contexts where you have low financial literacy, low financial education, you can actually expose beneficiaries to fraud and theft. So you can actually create additional vulnerabilities where they didn't exist before. On stakeholder participation, the report reminds us of the core principles in 102 and 202 about participation of stakeholders in the management of schemes, how fundamentally important this is to establish these formal avenues for stakeholder participation, so that they can exercise management and oversight over the way that the schemes are run. Again, in contributory systems, these are normally established in law and are very clearly laid out. Which groups have which representatives on which on the board, and how frequently they meet, et cetera, et cetera. It's all very defined in law. However, there are problems with those systems, of course, that some of the studies on enforcement will get into. However, the key point in the review is to really point out that creating these formal spaces for tax-financed non-contributory benefits is really where the key challenge is for countries that are trying to extend social protection coverage to groups that have previously been excluded. And in these tax-financed benefits, when you're introducing new types of benefits, the voices are much more diffuse. So it's much harder to organize citizens and to enable and formalize participation mechanisms in a way that is really representative. So I think creative thinking is required in those spaces when the laws are being written around those benefits. For grievance and appeals mechanisms, I think, again, while enforcement is often viewed as unidirectional, so the state enforcing compliance with obligations by citizens, it really does work the other way around, and formal mechanisms for citizen stakeholders need to be in place to hold the state to account. And one of the key ways is through these grievance and appeals mechanisms, so that people can address their complaints to the state. And recommendation 202 lays out, sort of qualifies what these kinds of complaints and appeal systems should actually look like. I think the literature, which we highlight in the report, really concludes that these mechanisms need to exist on multiple levels, and they need to draw on multiple channels. So some of the levels, what do we mean by that? You might have internal mechanisms, you might have court systems, you might also have an ombudsman. So different levels that beneficiaries can take to appeal their case. And you also have to have multiple options of channels for them to express those grievances, so that you increase the likelihood of all different types of people accessing those in different ways according to their capacities. Some of the other evidence that we highlight suggests that these individualized, in that literature, life cycle programs really do lend themselves more readily to redress and accountability mechanisms than the poverty targeted schemes. So a consistent theme, which we'll see in the case studies, is that really these are the schemes where the most complaints are about program design and exclusion errors. So for example, in the case of Georgia, they've got these universal old age and disability benefits that are reaching basically everyone who's in the system. Then they also have a poverty targeted TSA, child and family household benefit. They're all run by the same agency. Almost all of the complaints that agency receives are related to eligibility for the TSA almost no complaints with the individual benefits, despite the capacity to deliver on those benefits being the same because it's being delivered by the same institution. So again, grievance and appeals mechanisms in the non-statutory social protection programs are really, really lacking around the world. And this can undermine rights and trust in the system. So some of the key takeaways from the global overview, really you will have seen the overarching finding, whether you're talking about high level, mid-level, or the front line, is when thinking about the ability of good governance of social protection systems to further the goal of universal social protection, to end poverty, what is most effective? You cannot avoid that policy and scheme design matters. So no matter how you take up the question, you'll always end up grappling with those kinds of distinctions and implications. And what we lay out is that actually these core life cycle schemes that are really the workhorses of the successful social protection systems, the ones that have achieved or are making great strides to achieve universal social protection, they are really grounded on these individual entitlements, the core life cycle benefits that have historical basis, and the ones where it's focused on very specific groups, have much different implications for governance, and in fact create their own problems at all levels, high level, mid-level, and at the front lines. And then we also, a key takeaway is that contributory and non-contributory programs are really very different. They have different natures. They have different implications for MIS requirements, for stakeholder participation, for payment systems, and then also for these grievance and appeals processes. So that again, the identity of the scheme itself will determine what kinds of options and governance mechanisms are available and appropriate for different countries at different stages of developing their systems. And so I guess the overall corollary finding is that simplicity matters. And so even though it wasn't listed as a good governance principle, it perhaps should be added that in low resource context, simplicity is actually a principle of good governance in social protection. So I'll turn over to my colleague, Alex, who's going to tell us a bit about the case of Argentina.
Thank you, Stephen and Shay. To keep somewhat to our schedule, I would really ask the country presenters to not exceed 15 minutes, or if possible, to maybe try to limit their presentations to 10 minutes. So now we start with Argentina, as Shay already pointed out, will be presented by Alexandra Barrantes. She's a senior social policy specialist at Development Pathways. Please, Alexandra, the floor is yours.
Thank you very much, and good afternoon and good morning to everybody. Shay, if you could just please go to the next slide. Sorry, we have this centralization of slide sharing. So I'll try and shorten the presentation, then I'll go over some. I won't mention all of the slides, but I think the Argentina case is an interesting one in showing a few lessons learned that could be also useful for some other countries thinking about how to approach the governance of social protection systems. So some of the key lessons learned, I think, or some of the summaries for the Argentina case is that obviously in the case of Argentina, there is an underlying right to social security embedded within the constitution since the mid of last century. And it has a proper legal framework and institutional framework set up formally that has helped the expansion both in terms of coverage but also in terms of some of the schemes, as well as including the life cycle scheme within Argentina. It also has a wealth of coordinating mechanisms both at the national level, at the federal level, as well as including some of the municipalities and provinces that also speak to good governance. And then finally, there is this idea within the Argentinian context of the importance of intersectoral coordination as well. So the horizontal and vertical coordination issues that we were seeing at the global level that Shay and Stephen were mentioning is very much present in the Argentina case. If you can please move to the next slide, Shay. Then the other key messages that come across from the Argentina case are that Argentina is a context in which there is a coexistence of both an increase in coverage of the existing schemes, as well as in addition adding on different schemes to protect people throughout their life cycle, but also coexisting with a fragmented nature in terms of how those programs, how those services are provided at the national, provincial, and municipal level. So nevertheless, there are some interesting cases, and Shay briefly mentioned it, that is both in the case of Argentina and Uruguay, that bring about some innovations in trying to incorporate people that had been historically left behind, particularly those working in the informal labor market. And it's called a monotributo. Basically, it's like a mono tax. And what it does is it allows people who are working in the informal market to contribute towards the system through this tax system, right? This individual tax system. And that has definitely expanded coverage in the case of Argentina, as well as others that I'll mention a little bit further along the way. And then there's also, obviously, Jay just finished mentioning issues around management of information systems. And in the case of Argentina, Argentina has actually invested quite a bit in terms of developing some of these information systems. Some of them were also within the framework of what we have called in Latin America the lost decade and structural adjustment programs, in the sense that they were also meant to provide better targeting and efficiency of resources in some of the cases. And then finally, there's also a wealth of different instruments and tools and mechanisms that have been put in place in Argentina to be able to provide some of the lower level, street level governance pieces that Shay was mentioning with regards to accountability, participation, redress, and such mechanisms. So if you can go to the next slide, Shay, please. So as I said, it's a good example, Argentina, of a gradual expansion accompanied by an institutional framework, a legal framework, as well as of all the different mechanisms, coordination mechanisms, accountability mechanisms that Shay was mentioning. Having said that, one key issue in the case of Argentina, and I think this is also a very good lesson learned or something to look at, is there is a difference as well between the formal arrangements, but either institutional, also normative frameworks that a country might have in terms of governance, and also the dynamics of informal power dynamics. So that's something that in the case of Argentina is very vivid and is very present throughout the history of the growth and the historical the growth of the Argentine system. So if you can go to the next slide, Shay, I'm going to catch up. Can you move forward? Basically, this just shows coverage in terms of, but what I wanted to say is there is a very high coverage, around 72% for children and adolescents up until 2018. And then for elderly people, it's around 98%. So coverage in Argentina for both non-contributory and contributory schemes in Argentina is quite high. Nevertheless, as I was saying before, there's also fragmented nature that is mostly linked to the fact of who is part of the formal and the informal labor market, because some of the both levels of benefits as well as some of the conditionalities attached to them are different depending on the labor market. And also there are some differences between coverage, obviously, as you can see here, between children and adolescents and elderly people. If you can move to the next slide, Shay, please. This is just a very brief historical account. It's my own historical account, I suppose, in terms of how the Argentine social security system has developed over the past few years. So you can see that Argentina has very much linked its development in line with what had been in the European welfare systems, the Western European welfare systems, with regards to linking it to labor market, and then gradually adding family benefits, family allowances, and non-contributory schemes to be able to increase the coverage of other people and people who had been left behind due to the nature of their work. So you can see here that this is a mix between contributory and non-contributory schemes, Argentina. I can't go into detail, but there's a wealth of information in the report itself if you want to look at how it has been developed. I think it is important for countries that are also starting from scratch or starting from a very basic level of coverage and institutional arrangements to look at the Argentinian case, because it does show a consistent expansion and also consolidation of institutional arrangements. And all of this in this timeline also is accompanied by a wealth of laws and bills that put into place the whole system. If you can go to the next slide, please, Shay. This again shows you, after all of that transition, that historical account. It shows the current structure of how both life cycle benefits and non-life cycle benefits and additional services look like in the case of Argentina. So it includes family allowances for different life cycle risks and vulnerabilities. It also includes contributory and non-contributory schemes, a wealth of pension schemes. In the case of Argentina, just to add on to the complication, and this might be the same case with some other federal states that have a federal administration at the governance level. In the case of Argentina, there's over 120 pension schemes at the provincial, national, municipal, professional, and sectoral. So there is also a wealth of complication in terms of how large the system is and how the ample series of programs that have been put in place to be able to address coverage and also the expansion and coverage of life cycle risks. If you can go to the next slide, I won't be mentioning this one. You can go to the next slide. So some of the challenges, I have mentioned some of the core components of what governance looks like in Argentina. Formally, Argentina ticks most of the boxes that you would look at in terms of governance, both at the national level as going to the mid-level, as well as the lower level in terms of implementation. But in terms of the challenges to the higher level, I think there is still some of the gaps that I mentioned in terms of the coverage gaps, as well as the fragmentation of the nature, because it's different depending on people working in the formal labor market versus the non-formal labor market. There's also the coexistence of different institutions and coordinations, and there's a lot of power struggles and have been power struggles within those institutions. So even when you look at and I think we're going to look at that in a few slides, the institutional arrangements that have been put in place in Argentina, they're not necessarily the same as what an informal power dynamics work like in the case of Argentina. And then I mentioned the somewhat stratified nature of the provision of social protection, which is also a challenge looking forward. If you can just change the slide. So in terms of high-level mechanisms to improve governments, in the case of Argentina, we could say that Argentina has ticked most of the boxes that Stephen and Shay were looking into. At the higher level, we've got social protection policy frameworks, we've got institutional, both the formal and informal arrangements, and coordinating mechanisms that work in some cases better than others. A sustainable financing structure is also something that in the case of Argentina has a very strong investment in social spending, and in particular for contributory and non-contributory schemes in the case of in that case, particularly for to this year or last year's budget. We also have management information systems, as I mentioned, and there's also a set of federal and decentralized structures because of the structure in Argentina being a decentralized system. And then finally, there's a wealth of implementation schemes and accountability, participation, and redress mechanisms that have been put in place. I'll try and go over some of these quickly, Shay, if you can share the screen. You can change. I've mentioned this already. We can go to the next slide. This is the institutional arrangement that you see in Argentina. It's a fairly simple system. When Stephen was showing some of the examples, it doesn't have too many institutions involved. But one of the things to note on this is that obviously a Ministry of Labor and Employment, which is one of the traditional ministries that most countries have had since the 20th century, is a ministry that is very strong in Argentina. And eventually, if we look through the history, then a Ministry of Social Development was also created, as well as a national social policy coordinating mechanism. Nevertheless, it's important to note that the National Social Policy Coordinating Council has more of a monitoring and a sort of accompanying and following up on social policies necessarily than actually coordinating at the ministry level. That obviously has changed throughout the past 30 years, depending on who was in government and the informal power relationships between some of those institutions. And one of the key issues I would like to point out to the case of Argentina is that an administration, a decentralized organism such as the ANSES, which is the National Social Security Administration, is actually the organization that holds, it's the one in yellow at the left corner, and it's the one that holds most of the power with regards to the administration and the implementation of Social Security in Argentina. If you look at what ANSES has under its purview, it has a wealth of most of the largest both contributory and non-contributory schemes under its responsibility. And this is a very particular case, and I think it's also an issue that has had a very strong impact in terms of the governance and accountability for Social Security in Argentina. If we can move slides, I will have to go through, but let's move through these slides, Shay, just so that we want to. So at the higher level, again, as I said, there's the legal framework, and the most important issues is that concentration of power of ANSES over some of the other ministries in terms of, and if you look at that life cycle scheme and the life cycle benefits, it'll be ANSES that is mostly responsible for this. So this slide goes into mid-level, and I just wanted to mention a few of the systems that have been put in place in the case of Argentina. SINCTIS in particular is a system that goes beyond social protection and social security. It includes tax, it includes a lot of other information, and it links also to a civil registry in Argentina. So there has been a big investment in the case of Argentina. And accompanying that, and that's something I wanted to mention in terms of good governance, there's also a wealth of legal framework that has been accompanied in terms of data protection, the right to privacy, and some other laws that have been passed that accompany some of these systems. There's also, SIEMPRO is also a system for monitoring some of the social policies under the coordinating council. And I just wanted to mention also that in December of 2020, when you recall that I mentioned that Argentina has over 120 pension schemes, both national and subnational level, and even going into some of the specific professional sectors, Argentina has just established a registro de entidades previsionales, which is, well, in English, registry of social security entities. And the idea is that all of those different regimes can register so that there is a coordinated mechanism or coordinated effort in terms of putting all of those under one same roof. Shay, if you can move ahead. There's, in terms of those systems, obviously, there is a lot of investment and has been a lot of improvements in terms of interoperability of some of those systems, but there are still obviously challenges in terms of who can access them, how to register. They're basically open to most agencies. They have to go through a process, but there are still gaps in terms of being able to use some of those systems, in particular at the subnational level, right? So those are just some challenges so that we don't point to a perfect picture. I'm almost done. My colleagues are telling me, so I'll just try and go into some of those other mechanisms. In the case of Argentina, if we're comparing it to other federal states, we also need to look at what kind of structures you have at the subnational level. Some of them work better than others. There's a lot of, again, informal power struggles between different provinces and funding that is set aside for them for Social Security. If you can go to the next slide, Shay, please. There's also very good mechanisms in terms of street level implementation. There are still challenges both at the contributory and the non-contributory side. There's a lot of literature in terms of some of the schemes, such as the Asignación Universal por Hijo, which is a non-contributory scheme, and there is a lot of research with regards to some of the issues in implementation, which are very much related and alike to some of the challenge in terms of conditionalities, in terms of access to services, documentation and what have you, and extra costs that are very much alike other countries as well. But there's also a wealth of different redress mechanisms and also information outputs. Shay mentioned the communications of some of these programs. And in the case of Argentina, the government of Argentina has made a very good effort in trying to put forward some of these leaflets, for example, in terms of information about the rights that beneficiaries hold with regards to all of those life cycle programs, contributory, non-contributory, and also the Ministry of Justice, Ombudsman, and other figures have had a role in making sure that the redress mechanisms are in place. There's accountability. Obviously, it works better in some programs versus others, but in many cases, there are those instances, they are in existence, and there's also from digital platforms to hotline calls, as well as other implementations at the subnational level and offices. Shay, if you can move ahead, I know we're very much pressed with time, but I think there are issues in terms of the governance of all of those with regards to still having problems with accessibility, and there's also some that have been left behind. There's particular concerns about persons with disabilities and some other marginalized groups, but I'll try and continue. I'll try and you can look into the research in detail. I'll stop there, I think, Shay, just because I think we're very much pressed with time. Sorry for that. So the Argentine case, just to finish, is again a very important case in point, I think, to showcase some of the formal arrangements for governance, but also I wanted to point it out to the informal structures and power dynamics that are in place that also have a say in governance. And I think it's also a good example of how coverage has been expanded, and that coverage expansion, both from the contributory and non-contributory side, has very much been backed by those governance arrangements and mechanisms that have been put in place. And I'll stop there. Thank you.
Thanks, Alex. I'm going to turn over to Serena now to present the Kenya case. Yes.
Serena, I would very much appreciate if you could limit the presentation until, I think it's your time, 11:40. That would be great. And I would also encourage the participants to put questions to the individual presenters in the Q&A function, and maybe the presenters can answer them in writing, so we save a little bit of time. So let's move over to Serena, please. You have the floor.
Thank you, Robert. So next slide, please, Shay. So we chose to talk about Kenya because it's an example of a country that's moving towards implementing a life cycle based social protection system, and the good governance and sometimes not so good governance decisions that enabled this transformation. So following independence, Kenya started to implement a series of social policies with the aim of building the nation and bringing unity to its many ethnic groups. But in terms of social protection, its early institutions were the National Social Security Fund, which was a provident fund, and the National Hospital Insurance Fund and the Civil Service Pension Scheme, which were all aimed at the formal sector. So there was very little for the vast majority of Kenyans who were working in the informal economy. And so the social protection system for Kenya was largely characterized by small scale fragmented interventions, which were dictated by donors or IFIs that were giving loans, and they were cash or in-kind support that were delivered on an ad hoc basis. And things began to change in 2002, but it wasn't until the promulgation of the 2010 Constitution, which enshrined the right to social security, that Kenya began to make significant strides towards developing an expanded nationally owned social protection system. And you can see from the graph how much funding for the schemes has shifted over the years to be largely government financed. Next slide, please, Shay. So over time, schemes such as you can see here, cash for assets, food for assets, general food distribution, since 2012, those have shrunk and they were very poverty targeted. And the more life cycle based schemes were implemented and expanded under the National Safety Net Programme. So there was an Orphans and Vulnerable Children scheme, which was poverty targeted. There's a disability benefit, which is poverty targeted. The Hunger Safety Net Programme, is geographically based and poverty targeted. And it really, the key scheme came in 2018, which is the Inwajami Senior Citizen Scheme, which was an expansion of a previous poverty targeted old age pension. And it's basically it's a universal pension. Well, it's pension tested, but a universal pension for all people over 70 years of age, and it's completely government owned. And it's the first national universal pension to be introduced in East Africa. And so, currently the government's also examining the feasibility of implementing a universal child benefit. And these advances would not have been possible without Kenya significantly strengthening its governance arrangements. Next slide, please, Shay. So the first significant change was strengthening the institutional arrangements. So first came if you can see the acronym SPS, that's the Social Protection Secretariat, and that was strengthened firstly. And after that, the government created the State Department for Social Protection, which became the institutional home for 3 of the programs, the Orphan and Vulnerable Children Benefit, the Disability Benefit, and the Old Age Pension. So they suddenly were housed in the State Department of Social Protection. And then the SPS, which is responsible for the strategic direction of social protection, as well as policy development, was also housed within there. And then the next big thing was the development of the Social Assistance Unit, which is SAU, S-A-U, which you can see is also housed within the State Department of Social Protection. And that is responsible for the sort of operational processes of these 3 schemes that I mentioned. And so this achieved a number of things. Firstly, by strengthening the SPS, which was responsible for policies and strategic vision, this really helped the government drive forward its vision of implementing the Inwajami Senior Citizens Scheme, the old age pension, and to move towards implementing a life cycle social protection system. And by creating the Social Assistance Unit, which is responsible for the operational processes, this streamlined the sector by bringing all these fragmented programs under its purview. So now these programs share administrative processes, they learn from each other, and monitoring and evaluation and sort of across the board. There are, however, a number of gaps still, which is inevitable with countries that are at the first stages and they're trying to streamline their processes more. So there's still a degree of horizontal fragmentation. So you can see in the orange boxes at the top that several schemes, the more poverty targeted schemes that are based around emergencies and droughts, like HSMP, are in a different institution, which means that they're not going to be so aligned to the vision of the SPS. There's very little coordination between non-contributory schemes and contributory schemes. So even though the National Social Security Fund, the NSSF, is located in the Ministry of Labour and Social Protection, it also there's very little linkages between the non-contributory and the contributory programs. And there's also a great degree of vertical fragmentation, because you can see underneath in the purple box in the State Department of Social Protection, you can see that there's county social development departments and the children's services who are located underneath, and they're actually responsible for implementation on the ground, but they're not actually responsible for social protection. They deal with like social services work and stuff, and they actually answered to their parent department rather than SAU. So this creates a lot of reporting issues. And I would say one of the main gaps at the moment with Kenya's system is that at the very ground level, the system still relies on volunteer structures. As I'm sure everyone is aware, volunteer structures, if they're the first stage for communication with beneficiaries or grievance and complaints mechanisms, they often don't receive much training. And they're often not very motivated to do a good job because they're not actually paid. And this is largely where a lot of Kenya's good governance structures and policies fail, because of, as we get further down the line, they're not implemented very well. Next slide, please, Shay. So despite this horizontal and vertical fragmentation that I've talked about, though, Kenya has used technology to bring more coordination. So this is, as Shay has already discussed, MISs are very important for operational processes. So I won't get into further detail why they're important, but until 2013, some of Kenya's key programs were still paper-based MISs, where the information collected was very limited and they were transported by vehicle from the districts to the national level. So now the government, all the schemes, all the main schemes use electronic MISs, which has increased transparency, efficiency, and accountability. And the child benefit, the disability benefit, and the pension are all now under one MIS. Next slide, please, Shay. But the government didn't stop there. So the most important thing they've done is implement a single registry. So this was launched in 2016, but it's still being adapted and changed, and more is being added to it. And it consolidates the data from various management information systems from different programs into one unified database. So even though there's all this fragmentation, you can see here that the single registry links to the HSMP, which is located in a different institution, then to the CCTP MIS, which includes those 3 programs I talked about, and also a WFP program. And then you can see at the top, it's also accessing data from the National Population Registry. And so even though there is this fragmentation, it's greatly increased harmonization and consolidation. There's a better allowed oversight, and it's obviously much more efficient and reduced paperwork, and it allows a bird's eye view of the social protection sector, which can improve monitoring. And obviously it also helps to prevent fraud in this. So I would say this is one of the major achievements that Kenya has done, right? Despite the sort of messy stages with the institutions, even though it's worked to improve that, technology has helped to bring greater coordination. Next slide, please, Shay. The third area that I want to talk about is another use of technology, which is at the street level in terms of how the government improved its payments system. So as many of you will know, payments often start off manually, which is, a van turns up and people are paid cash, which makes it very difficult to track. A lot of fraud can happen. There can be leakage, you can have ghost beneficiaries. And so this was how a lot of Kenya's schemes were initially being paid, but now everything is paid electronically through a bank card and a bank account. Shay, next slide, please. And it wasn't until the rollout of the universal pension that Kenya launched a choice model for payments with the aim of increasing competition between banks, with the idea of improving service, in which recipients had the choice of one of 4 banks. And the idea was that banks would then improve their infrastructure on the ground and try and get beneficiaries to choose them. And this also brought more autonomy and choice for beneficiaries, because before they had to go to to collect their money at a set time and a set day, which isn't a very dignified way of receiving your entitlements, because you have no choice over what you're doing with your day and you just answer to the government. And so this was a big move towards improving operational processes on the ground, though, as often happens, there are a lot of limitations, and this largely comes down to Kenya not having yet a robust consumer protection and financial services framework, which means that often a lot of the bank agents on the ground don't always follow process. Recipients still have to maybe travel more than 5 kilometers to a pay point. And especially with older pensioners, they didn't always receive the training needed to operate a bank account, having never been formally financially included before. And so there are still limitations here. And ultimately, if you're lacking this framework, it's up to the government or the donor to make sure that contracts with the payment service providers are very airtight, with standards in place to make sure that providers follow sort of international guidelines. Next slide, please, Shay. So to summarize, I mean, there's many more aspects to Kenya's transformation. So I've just focused on 3. But what really stood out was Kenya has made a lot of good governance decisions, but they're not always executed in practice. And this comes down to lack of resources quite often, and that can really hinder. And the more you go down the ladder at the national level, it's fairly well resourced, but by the time you get to the county level or on the ground, then you're lacking the resources, and that can stop these policies from being implemented. Nevertheless, Kenya is an excellent example of how like an emerging low-income or middle-income country can work towards implementing a life cycle social protection system. And its usage of technology has really improved governance processes. And I think there's a lot to learn for countries that are often at those early stages, which are often quite messy, and they're trying to now take ownership, both financially and strategically, of their social protection system. There's a lot to learn about from Kenya, of how Kenya's dealt with it and what to watch out for, the barriers that will be faced. So that's it. Thank you.
Thanks, Serena. So I'll just go straight into the small island states, Mauritius and Fiji. So we looked at these 2 together. I really enjoyed looking at these because it was really interesting to see the story, the sort of parallel and crisscrossing stories that emerged from the research that we did. So the key messages, starting with Mauritius, are Mauritius is really well known in Africa, but also around the world for having a really well-developed and institutionalized social protection system. And this is especially in relation to its universal old age pension system. So I think that's important to remember as we look through Mauritius's story. While it has followed this inclusive sort of life cycle approach for certain categories, and we emphasize older persons, persons with disabilities, widows, as we'll see when we present the diagram of the system, the policies that have been aimed at younger cohorts at working age and at children have been less inclusive historically. So we'll see how that maps out. And I think recent policy choices have really signaled what might be, and we're careful to say might be, a potential tilt away from this kind of universal inherited rights-based framework and potentially toward a strategy that is really centering on poverty reduction and the concepts of empowerment and conditions for younger cohorts. So this is exemplified by this sort of Marshall Plan social contract that I'll talk a bit about, that emphasizes conditionalities where they didn't exist before, and poverty targeting, and trying to systematize those processes. So to support this new orientation, the government has also created new administrative units with administrative functions, and that's throwing up new sorts of politics and veto players that that show themselves throughout the process, from the high level all the way down to the front lines. But I would say overall, despite these kind of shifting sands, it does appear that the frontline governance structures have really remained intact and strong. And so that single window service that's offered in Mauritius has stayed intact. And I think that's really against the odds. So quickly, an overview of the social protection system in Mauritius. No time for detailed explanation, but just to note that Mauritius really does have, you can see from the collection of benefits, a relatively comprehensive social security system. It's multi-tiered, so it's a combination of contributory and life cycle for, again, emphasizing old age, disability, but also survivors, widows specifically. But as mentioned, investment has really been skewed in favor of older persons compared to children and working age. So these are some of the ILO estimates from the last World Social Protection Report, where the investment really doesn't even compare in those age groups to what the government is spending on the old age pension system. This, you can see this in other countries, and there are reasons behind that. Pension systems are generally more expensive than other types of benefits. So, but I think still it's worthwhile showing this imbalance. Also on non-life cycle benefits, relatively small investments. So historically, that's not been a focus of the government's attention. And in any case, those programs are designed to remain small. And so investment rarely increases much in those supplementary non-life cycle programs. So in terms of the high level institutional arrangements, In Mauritius, you do see, as I said, you've got the single ministry that is charged with administering most of the income transfers in Mauritius. So this really is the central institution for delivering the core life cycle programs, except for health, which is separately managed by the Ministry of Health, as in many other countries. And it also administers social assistance benefits. There's also some coordination at the high level across institutions. So historically, Mauritius has given the power of contribution collection to the Mauritius Revenue Authority, which collects contributions on behalf of the ministry and then transfers those funds to the ministry to administer the benefits. So that collaboration has been in place for a long time and is still functioning. They've introduced 2 unemployment benefits that are split between 2 ministries, so that could create problems, and the report goes into more detail. We won't in the presentation. And then I think what I want to zero in on is the creation of this new ministry, the Ministry of Social Integration and Economic Empowerment, and underneath it, the National Empowerment Foundation. So the NEF was created in 2008 and really trying to consolidate all of the knowledge and information on poverty and the poverty targeted programs under the social aid benefit package. And then the ministry was set up following that, so about 10 years ago, around 2010, to try to consolidate these anti-poverty programs targeted at the poor. This was supported with funding from the UNDP. Through that, they've invested in some of the midline or the mid-level MIS systems, which we'll go into later. But again, this has created sort of not necessarily a challenge, but certainly a new actor in the social protection sphere, and has kind of meant that this definition, the national consensus on what social protection, social security is now contested. So social protection is starting to be thought of as these anti-poverty type programs, and social security is the core life cycle program. So that's created a dichotomy, or perhaps deepened a dichotomy that wasn't quite emphasized before previously. So turning to the mid-level, I think the development of the MIS systems really does reflect this recent general shift in orientation. So the single registry in Mauritius existed well before this new social registry that's been put in place. It had been held up as an example internationally of good practice in single registries. The SRM, on the other hand, was introduced with a very specific objective, and that was to improve coordination of these social aid benefits. So if you remember in our diagram, the benefits on the bottom, that's why the SRM was introduced. Capacity is generally high in Mauritius. It's a tech capital in Africa, so it's not really a surprise that the SRM has received international recognition and is essentially well administered as far as these social registries are concerned. As we mentioned in the global overview, this social registries can complement, but they can't really replace the single registries because they perform different functions. And that is indeed what we see happening in Mauritius. So you do see that these systems are kind of working together, but the social register, the SRM, is performing a very specific function relative to the overall social security system and social protection system in Mauritius. We also note in the paper that the SRM, of course, might solve certain issues, but its purpose really isn't to contribute to coverage extension. And it also faces some of the same risks as all of these social registries do, including high exclusion errors and high administrative costs, some of which, because the system is so new, haven't really come to pass. So there's not a lot of information yet and not a lot of evaluation that's been done. But given the experience of other countries, that's what we expect to happen in Mauritius. So some of the street level mechanisms, I think the main thing to focus on is this single window. So the Ministry of Social Security does have a lot of offices for a relatively small population. There's easy access to pretty much anyone in Mauritius and on Rodriguez who can interact with frontline workers, go submit their applications, basically do anything that they need to do benefits wise at these single windows. And since October 2018, and I think this is a really important point, SRM registration is also carried out in these local Social Security offices. On accountability and grievance, I can't spend too much time because I have 2 countries to cover, but just to note, there are charters that the ministry signs with its citizens. So that is a good practice in and of itself, that the ministry takes the time, each ministry, to draft a social charter that really articulates what its responsibility is. So when we think about that two-way obligation, the two-way compliance and accountability, Mauritius is doing that in articulating it. However, what we see when we actually look into those is that it's a much stronger charter, the one related to the life cycle schemes, perhaps because of its history, but much, much weaker in relation to the poverty target Marshall Plan programs. There, the energy has really gone into creating very, very detailed contracts between the state and individuals through the social contract, through the Marshall Plan contracts to enforce compliance by individuals with the conditions of the program. So you can really see a different emphasis in these. Turning to Fiji, again, trying not to rush, but I hope the overall story comes out. The cover story really in Fiji has been the introduction and the expansion of the social pension scheme nationwide in 2013. So we've seen, it's kind of the untold story in social protection circles, but coverage has gone from 30% to now nearly universal because of changes to eligibility requirements. So not even necessarily introduction of a new law, just regulatory changes over time. You can see this in the diagram is in the report. But a second emerging story is with regard to the care and protection allowance. So this used to be a household level benefit. It's now being converted to a child benefit little by little. It still means tested, shifted to per child transfers within the household, which we note as a potential sort of orientation shift away from a household type logic and toward a more individual entitlement. So we highlight that, although coverage is still very low. I would say in Fiji, social protection is still not seen as a sector or a system. So it's still very fragmented. However, significant reforms, and especially related to the social pension system, have resulted from national consultative processes. So even though there was no overarching strategy or idea of the social protection system as a whole, there was an individual issue-based consultative process around the National Policy on Aging that then led to creating an opening for the kinds of regulatory changes that have resulted in really rapid expansion of the SPS. So we would predict that SPS, although it has been achievement, because the overall governance, high-level governance structures have not been put in place to start to identify goals and long-term strategies for the sector, I think that coverage in other areas and for other groups is probably not going to take off in the same way unless you do similar issue-related strategy processes like what happened with old age. So looking at the overview, I'm not going to spend time on this. The main 2 things to point out is that it looks like a lot of systems out there where you have this provident fund or contributory fund for a very few in the formal economy, and then you've got this collection of other social assistance benefits, out of which that Social Justice Act of 2001, which was enabling legislation. So remember, going back to the global overview, enabling legislation in this case was you were able to take advantage of that through other specific national processes to give rise to the expansion in the SPS. The only thing to say about the high-level governance here is that the institutions do reflect this bifurcation. So we do have the Provident Fund on one side under the Ministry of Finance, and then you've got this other ministry that has very much a poverty alleviation focus, a vulnerable people focus, which again, many of you will find looks familiar in your contexts. And that's the main thing to say there. The rest can be consulted in the report. At the mid-level, I'm just gonna point to two quick things. First of all, we review some of the challenges and the solutions that are present. I don't think there's a big story necessarily on the MIS systems, other than the fact that the systems that are in place have challenges that are essentially related to the design of the programs themselves. So you have slow connectivity, that's about the overall ICT environment, inability to capture all of the necessary information. So these are problems that really come down to problems that are not necessarily about the MIS system itself. And on the Provident Fund, you've got, like in many countries, you have a lot of investment that's been going into creating a better MIS system, to managing lots of information related to contributions, fund management. So there's a lot of progress. You've got strategy documents, looks very professional. But again, let's recall that this really only caters for about 8-9% of older people, and only those that are employed in the formal sector. So again, it's not really at the frontier of what's happening in terms of expansion of social protection. On the street level, you see a lot of these same themes being replicated. So there are challenges with the means tested benefits that derive from the way that the schemes are designed: long wait times, inadequate communication. We have welfare officers that are required to be both a social worker and cash transfer administrator. So lots of different challenges. There have been steps put in place to try to overcome these: electronic payment systems, plans to implement a call center, etc. But I think it's still too early in those cases to see whether they've been effective. And essentially, there's not much literature out there yet because they're so new. On the Provident Fund side, again, lots of advances in terms of making things easier for members to access their funds, to withdraw, to levy complaints against the system. So lots of progress on that fund, but again, coverage is small. So the extent to which that actually improves or gets us further toward the goal of universal social protection is open to question. So just a very quick slide on a comparative focus, because I think what's interesting about having these two studies together is that both of the countries, you see a common theme in that they've placed a lot of hope in these relatively small benefits: social aid benefits in the case of Mauritius, and the poverty benefit scheme in the case of Fiji, which I didn't have much time to talk about. Their explicit purpose is to reduce poverty, but actually, as we know from looking at lots of these systems around the world, many of those benefits artificially reduce eligibility for benefits according to predefined thresholds. So their intention is not really to expand coverage. There have been administrative improvements, and they're always possible. So again, closing that gap between legal coverage and effective coverage. But then the difference that they will make to overall coverage extension is probably going to be marginal. And so they also themselves pose challenges to governance at lower levels that came out clearly in the case study. We also see that external actors have been involved in both cases. And in one story, it might be, I wouldn't say a negative story, but questionable. And in the other, they played a really supporting role. So I think that's all I'll say on that, but it's another theme that comes out in the comparison. And Mauritius has introduced a lot of risk into the social protection governance processes with this shift toward and the attention going to the Marshall Plan and empowerment framework, while actually Fiji we see is kind of moving from that mindset into a more life cycle based mindset. So they really are looking like they might be going on diverging paths. So I'll leave it there and hand over, maybe I'll stop sharing the screen.
Yes, thank you very much, Shay, and thank you to all the colleagues at Development Pathways. So after we have basically gotten the global overview, as well as case studies from one from South America, one from Africa, and 2 small island states, we're going to move now to Asia, to China, a country much closer to Pakistan and Cambodia, our project countries. And I would like to invite Professor Hong Mi and Ms. Kwijini Ma of the Zhejiang University Department of Social Security and Risk Management at the School of Public Affairs. Please, we are looking forward to your presentation.
Okay, thank you so much. I'm Hong Mi from Zhejiang University. our presentation is focused on research, on coordination and implementation of social protection systems in China. My co-author is Ms. Qi Nima. Okay, next. Okay, China is the world's population populous country where the population changes from getting old before getting rich to getting wealth while aging rapidly. Elderly people and migrant workers are the largest vulnerable people in China's social protection. The number of people aged over 65 years reached 176 million in 2019, accounting for 12.6% of the total population. However, in 2019, the total number of rural workers immigrating to urban areas related to economic need reached 291 million. Next. After 70 years of development, has successfully established a multi-dimensional social protection system based on social insurance, social welfare, veteran placement, social aid, and housing security, which focuses on pension, basic medical care, minimum living security, and etc. The system is also supplemented by charity and commercial insurance. Next slide. The figure shows the historical events of China's social protection system since 1950. To address population aging, China put a high value on rural social protection and carried out a pilot scheme for rural pension system, in Chinese, 老农保, since 1991. At present, China endeavors to adopt a national long-term care. At present, China endeavors to adopt a national long-term care insurance system from 2016 to now. 49 Chinese cities have embarked on numerous long-term care pilot programs. Next slide. In the long history of China's social protection establishment, the special characteristic can be summarized as follows: emphasizing not only on efficiency, but also on efficiency plus justice, insisting on the pilot first principle, attaching great importance to rural protection. Next slide. Chinese government insists on making the system fairer. The protection model has been changed from high efficiency, weak justice to high efficiency plus strong justice. Next slide. To promote better life, Chinese government highlight the importance of wide coverage and high precision coverage to best satisfaction the needs of all the different groups. Next slide. The government placed a strong emphasis on no one left behind to address issues of elderly poverty. China introduced the zero-pillar pension system and achieved full coverage of Social Security. Next. Now, I invite Ms. Qi Nima continue to introduce the presentation.
Hello, everyone. Now I'm going to show you the development history of China's social protection system and try to answer how China ended poverty through the system. We will highlight the importance of Chenxiangjubao, a rural pension system, and we'll see how central government and the local authorities coordinate in the system to achieve this common goal. When China came to design its policy, it gave priority to the disaster's victims and unemployed workers. In 1951, the labor insurance regulations was enacted, and China's social protection system began to take shape. In urban China, some people enjoy social security benefits since 1951. Those people were government officials, staff of government-affiliated institutions, and the SOE staff. Well, in rural China, the government focused on people's basic needs for shelter, clothing, food, medicine, and burial. It was called Wu Bao Hu living support system. Since 1978, China carried out a series of reforms to the social protection system. From then on, the financing responsibility is not only shared by the state, but also the enterprises and individuals. At the same time, a multi-dimensional social security system was established, including social insurance, social welfare, social assistance, social aid, veteran welfare, and housing welfare. However, social insurance is the core part of the system. After 1978, China advanced rapidly. Gradually, China set up a three-pillar pension system. The first pillar includes 城镇职保 and 城乡居保. They are different. They have different requirements on contribution. The second pillar is enterprise annuity. The commercial pension scheme is the third pillar, which allows for deferred payment of individual income tax. Here, 2 points will be highlighted. First, until now, most people only participate in the first pension pillar scheme. Beyond the three-pillar pension system, China also created the zero pension pillar system in early time by providing financial support for rural elderly people without individual accounts. Well, China has large population in rural areas. Since 1982, China introduced a rural pension system called 老农保. You can see here, 老农保 here. To expand the coverage, China changed the financing pattern to encourage rural people to voluntarily participate in the pension system since 2003. Well, so we have 新农保 and 城乡居保 rural pension system here. We must highlight that 城乡居保 rural pension system is a huge milestone in the history of Chinese anti-poverty social security system. So how much does a rural pensioner get from Chinese government when he or she retires? Well, I can tell you, the average level is RMB 88 plus 49 equals to 137 yuan per month. Here, 88 yuan is given by the central government, and the 49 yuan is provided by local governments. If you live in a rich area, you can get more from the local government if the economy permits. So 49 yuan is just the average level. The central and local governments coordinate in two important schemes. They are pension contributions and pension payments. Well, the minimum contribution for a rural resident is RMB 100 yuan per month. It is the minimum level set by the central government. To encourage people to contribute, local authorities are obliged to subsidize rural contributors. The subsidies should be no less than 30 yuan per person per year. In pension payments, the central government hands out 88 yuan per person per month, whereas local governments pay according to the economic conditions. This figure shows how Chinese governments coordinate in rural pension system. We'll see local governments have done a lot to attract more people to participate in pension contributions, while the central government spends a lot of money on pension payments. Now, we'd like to highlight Chinese achievements in social protection. First of all, the Chinese system develops from nothing with a rapid pace. The success comes from the long-term exploration and practices. A series of pilot schemes were carried out since early times, especially in areas like rural pension system, long-term care, insurance, the third pension pillar system, and etc. Secondly, China has made resolutions to eliminate extreme poverty nationwide by the end of 2020, which is 10 years ahead of the goal set by the World Bank. And the problem of poverty of the elderly is alleviated by zero-pillar pension system. Thirdly, to promote a better life, the benefit level continues to rise. Fourthly, China put in place the largest social security system in the world by covering nearly 1 billion people. And the achievements have been recognized by the world. In November 2016, ISA awarded Social Security Outstanding Achievement Award to Chinese government. However, China still faces some challenges. For example, some vulnerable groups have not been covered by the system for their high job mobility. Second, the government's financial burden is heavy, which do harm to the policy sustainability. Thirdly, China lacks of various institutions to engage in the administrative management and service delivery. Fourthly, China should attach great importance to emergency management. We know long-term care facilities have been crowded during COVID-19. In a post-COVID-19 era, it's necessary to develop intelligence nursing equipment to replace manual labor as much as possible. Finally, we'd like to highlight Chinese characteristic of building such a system. China successfully established the system with large population in rural area. Chinese secret to realize full coverage in SPS lies in its governance strategies, the theory of limited financial resources and efficiency plus justice. Second, Chinese government emphasized on policy resilience and insist on pilot first. Third, China adheres to the people-oriented principle and pays attention to the livelihood of the vulnerable groups. Fourth, the government mechanism is designed to combine the advantages of normal governance and the emergency management. SSF is Chinese Sovereign Pension Reserve Fund, which is considered a type of sovereign wealth fund with an inclusive mandate to finance future public pension expenditures. Fifth, China focused on expanding social security asset growth as well as reducing the expenditure. So that's all for our sharing. Thank you very much for your listening.
Great. Thank you very much to our colleagues in China for this very interesting presentation. As you probably have seen, there are already many questions that have been posted both in the Q&A as well as in the chat function, and I would really encourage presenters to also check to maybe answer them directly, which many of you have already done. I think in the interest of time, I would just invite Amin now to open up to the other participants, and maybe we could have say 3 questions. If you would raise your hand, I would call on you, and please just keep it to the question, no statements, so that presenters can answer them in a very short amount of time. I mean, could you open up to the participants so I can see raised hands?
Yes, Robert, it's open. Let me just 1 second.
Obviously, in case you feel most of your questions have been answered in the Q&A function as well as in the chat function, we can also leave it there. I have to thank
sorry, Robert, Professor Hong Mi, he raised his hands.
Okay, please.
Okay, thank you very much for the wonderful presentation. I have a question for Stephen. Can you hear me, Stephen?
Yes, I can.
Okay, Stephen. Yeah, you just mentioned the very important concept that is the participation. Yeah, participation. Yeah, in the governance mechanism. Yeah, in the governance mechanism. Yeah, my question is, yeah, what would you please consider the minimum participation rate in the governance mechanism? Yeah, participation rate. Yeah, you know, yeah, it's very important in your high level governance. Yeah, participation. Yeah, I mean that the participation rate, yeah, you know, is very, very important index. Yeah, in every country's pension system. So my question is, what would you please give the minimum, the minimum participation rate? Yeah, in the high level governance. Thank you.
Thanks. I think that's actually quite a challenging question in terms of a participation rate. You know, I mean, are you talking? I mean, I'd have to. Are you talking about participation in terms of, you know, engaging with government in decision making and holding them to account, or participation in terms of number of recipients within a particular scheme? Which type of participation are you referring to?
Yeah. Okay. Yeah. I mean that. Yeah. You know, the satisfied participation rate. Yeah. You know, is 80%, 70%, 90%. Yeah. You know, the participation rate. Yeah, in the high level governance. Yeah. What would you please give the suitable participation rate?
Well, I don't know. I think I don't know. Have a clear answer. I mean, I think we want to make participation as broad based and as inclusive as we can. But of course, it's very, very challenging to do that. And much participation has to be done through representation, representative organizations. So often we have in social insurance scheme tripartite mechanisms of laborers, employers and employers participating in social insurance funds. What we find is such effective participation within the sort of tax financed schemes, and and that's an area that really needs to be enhanced. There's often very weak accountability mechanisms in holding governments to account, or often you have to the grievance mechanisms, which are a way of individuals say complaining about what has happened to them, are often very, very weak as well. So I couldn't give you a rate, but I think we would have to look at how you could best do it. I don't know, Shay, do you have a better answer than me?
Okay.
I was just writing a response actually on a similar topic that I think.
Okay.
Yeah, I think there's not clear recommendations that come out of that. And I think that some of the examples that are given in the report are context specific. So it may be that a certain country sees themselves in a specific experience. So I really would direct you to the report rather than, I didn't see general conclusions coming out on that. So I would direct you to the report.
Thank you. Yeah, thank you. Yes, in fact, as you know, in China, in the different pillared pension system, yeah, there are different participation rate. Yeah, for example, in the rural pension system and the urban pension system, yeah, the high level participation rate, it's maybe 95%, but in the second pillar, yeah, in the third pillar, yeah, it's very low participation rate.
Okay, so, I think
yeah.
I know.
Okay.
Yeah,
okay.
I think I understand better. So yeah. I think what we want to try and see is a broad system, multi-tiered system, in which we have for key risks that we're trying to address is 100% participation. For example, in the pension system, what we want to achieve is 100% participation of older citizens. However, as schemes develop, we want to increase the participation in the second pillar and broaden that out. But that will be linked to the levels of formalization within your labor force. Okay, so that it's kind of, you can't really address the participation in social insurance schemes without also addressing the formalization of the labor force. They're kind of very closely linked. But over time, you would want to get to certainly all employees should have 100% participation. When we fall below that, then they should be, in a sense, in a mandatory system. This should be illegal because it's meant to be mandatory. So we should be pushing 100%. But what a lot of employers do is they may be a formal economy employer, but they have a lot of their employees on informal terms so that they can avoid paying taxes. And so you really need to bring those in and really get to 100% participation of those who are legally within the employment, and try to then incorporate informal economy workers and informal economy businesses into the system. So you'll get eventually to hopefully 80-90% participation. But what we see in many low middle income countries are participation rates of 5, 10, 20%, and they're quite low and very, very inadequate.
Okay, thank you, Stephen. I just saw there are two more questions in the Q&A function. They slipped somehow into the answered column. So maybe if colleagues from Development Pathways could look at this just briefly. They're in the answered column. And if you could just briefly address it. Do I see any other raised hands for live questions? Not right now. Okay, if this is not the case, and since we are basically already almost 30 minutes over time, let me again thank all the participants, especially the presenters, both from Development Pathways and from Zhejiang University in China. Let me also thank Valerie Schmidt of the ILO, of course, Renyan Yang, who could not be with us today. And thank you to all of the participants. I hope this has been helpful to you, especially in the two project countries of Cambodia and Pakistan. I have already shared the papers with some of the colleagues in the two project countries. So I would ask them to maybe also distribute them for more detailed information than what could be provided through presentations here. Please write to us if you have any further questions. And yes, I would like to thank you for your participation and for the very interesting presentations from a variety of presenters. With that, I close the meeting, the webinar rather. Thank you so much.
Thank you very much.
Thank you.
Thank you, Robert.
Thank you. Bye-bye.
Bye-bye.